The misuse of prescription opioids has become an alarming concern among many people and lawmakers. Newsline reporter Berto Sanchez found that many people are choosing an alternative to deal with the pain. Berto, what can you tell us about this alternative to the pills?
Most opioid prescriptions are specifically for pain relief. Even when used correctly under a healthcare provider's directions, opiates can lead to dependence and addiction. So some people are choosing other less risky alternatives for dealing with their pain. According to the U.S. Department of Health and Human Services, the initial decision to take drugs for pain is voluntary for most people. It can lead to dependency and addiction, but there is an alternative for dealing with pain.
I've seen a lot of people, whether they're on opioids or whether they're on just lower level pain medications, through physical therapy, be able to come off of those because of the effects of just being more mobile and stronger.
Some people are choosing physical therapy and dry needling.
Small needles, there's no medicine involved, but these tiny needles, we insert them into muscles that have myofascial trigger points, and it actually helps release and reduce that tension, and in turn reduce the pain that's involved with those knots.
I like that it's non-medicated. It is honestly nice to use. I'm using something to relieve that discomfort that is not one more chemical in my body.
Some people are skeptical about the treatment, especially when they are dependent on strong painkillers.
Not going to help it. I take the medication, that's the only way I can function. And the only way you know is if you try. And you really can't say that it doesn't work unless you at least give it a try. And maybe it doesn't reduce your pain down to zero, but it gets you back to tolerable or functional, back to where you can actually do the things that you used to be able to do. Basically make life better.
This technique may not be a substitute to visit the doctor's office, but it is a good alternative to avoid dependency and addiction.
Because there are time and season for doctor. Believe me, there's a time and season for that. But when it comes to pain tolerance, it's just going to be magnified. Doing from one pain med and then getting more and needing more.
If you're looking to avoid surgery, live without painkillers, and return to an active lifestyle, physical therapists say patients should consider using this alternative. It doesn't cost as much, and it's a lot safer than opioids. Back to you.
Thanks, Berto.